Okay, Nico, good to see you.
Good to see you too.
All right.
Nice to be back.
Yes. So another episode of State Change, and this week we're really focusing on patient stories.
Yeah.
And I think it's really useful. It's really helpful for patients to hear about other people's experiences, and it really helps them to understand the latest kind of thinking and the effectiveness of plant medicine for a variety of different state changes that people want, that they desire, that they need to have in their lives, and how plant medicine can help them with that. So I'm excited about today.
Me too.
Beautiful day here in Zurich. Potentially a dangerous day. We're going to see. We were talking about there a couple of 4 or 5 years ago. We had an influx of people who cause a lot of issues. So we're seeing the police out and prepared. It's kind of an unnerving feeling, actually. It's not something that we're used to here.
But they look bored now. They all sit in their car enjoying the sun. So no, the last 2 or 3 years it was quite quiet. And before that we had some riots, and it's always, the police can never do the right job. If they're too present, people will say they provoke, and it's a police state and whatever. If they're non-present and everything gets destroyed, then everybody's saying, oh, why didn't they intervene? And No, I'm really excited about today. So because we got a lot of feedback, right? That patients or listeners also enjoyed to hear stories about why do people take cannabis, how did they end up there. So I brought 5 totally different cases, kind of, if you want to, from different symptoms where people used plant medicine. And we don't only want to talk about cannabis, but also, like, in general, what can people do also outside of the going to your GP and get a prescription for your Xanax if you cannot sleep. So kind of inform about these different things. And the first one that I think is a classic and one of the main indications for medical cannabis, but also a problem that many people face, is just chronic pain. And this specific patient, I will always never mention names or go into too much detail, but he had an amputation of his leg after a skiing accident, actually, and developed phantom pain. So we all know pain, how unpleasant it can be, and for people with amputations, it can be even a bigger problem. So it means that you have lost your arm, you have lost your leg, but you still feel pain in the non-existing leg. And it's something that is very challenging, because we know from science that if you have pain, you can have acute pain, like let's say you hit your pinky on the table, everybody knows it, how it feels, and it goes away quite fast. Once you have pain for a longer time, the problem is that you kind of develop a memory of the brain. So the pain itself really changes the structure of your brain. And you can imagine, kind of, if you're walking around grass, it doesn't matter. You can walk 2 or 3 circles, it doesn't matter. And the same way you walk in the grass, the pain walks in your brain. If it does 1 or 2 tours, after 5 minutes you stop, the grass will grow back, it doesn't matter. But if this pain stays in the same area for a long, long time, and you walk and you walk and walk, at some point the grass will die, and you will see the tracks, basically, of where you have been walking. And the same way it works with pain. So if these pain cycles in your brain continue, these nervous fibers get used more, and they become stronger, and you can see actually the track of the brain. And then even if you cut off your leg, the track in your brain is still there of the leg, and the pain can continue. And he tried all different kinds of therapies, started with like normal NSORs like your Advil or ibuprofen if you're more from Europe, escalated quite early on to opioids, which is, so when we treat pain in medicine, there's kind of this pyramid scheme. So you always start with NSORs, So non-steroid anti-romantic drugs like your Advil and your ibuprofen. If this doesn't work, you immediately go to weak opioids, which are not so many available. One is codeine, and the other one is tramadol, which some people know. And if that is not sufficient, then you go to stronger opioids, where it would be nice to have more categories, but because they're quite different. So you can morphine, which is probably the most well-known opioid, and then you can escalate further to stuff like fentanyl that we know from the US that's causing a lot of troubles, or also OxyContin. And then there are even stronger ones like medical heroin, basically. So diaphene and these opioids, and they work for sure. They will decrease your sensation of pain, but they come with a lot of problems. And the first one, which is quite obvious, is the addiction. And with OxyContin, for example, that can happen quite quickly. So even if you had, let's say, a surgery, you broken your leg, they could fix it. They don't have to amputate it. They say, okay, take this OxyContin for until you don't feel the pain. Some people are kind of feeling themselves quite well, and they take the OxyContin, let's say, for a week or so. Then you can stop with it. You can decrease the dose slowly, and it's not a problem. Very often what we see in medicine, that people, when they're ordered by the doctor to take something, they take it. And then let's say you should have a follow-up appointment a week later, but then maybe you couldn't go, or the doctor was not available, and the next appointment is in 4 weeks, and you say, okay, I will continue with the medication until I talk with the doctor about it. You don't feel the pain as much that you would need OxyContin, but you continue taking it, and after 4 weeks it can already be a problem then to stop immediately. Then you have to slowly decrease, and some people have no problem with stopping opioids. They can go from higher doses to zero quite quickly. Others, they feel then the withdrawal. And the other problem is also that opioids often have a lot of side effects. So dizziness, it affects also the congestion. So a lot of them have troubles going to the bathroom afterwards. When they take it, it can cause a lot of nausea. It can, through that, also decrease your appetite. And he went through all that. He said he had only side effects, not too much of effects, basically. And then he had a friend who was growing his own cannabis, who said, hey, why don't you try it with cannabis? And he didn't know anything about it. He didn't know why it would work. He just know, okay, he was also quite desperate, and he tried it and was amazed how well it worked for him. And then he said, okay, I can stop using the opioids and replace it with cannabis, but he was still quite afraid to talk with his doctor about it, until in August 1st, 2022, there came this change. And with this change, he was following the whole scene quite closely. Then he decided to get a prescription. And for him, this was really a game changer, because he had a lot of pain. He couldn't work anymore. Lost his job, was at home just treating himself. He was involved also with the insurance a lot, who in Switzerland, after a certain time, you get like invalidity insurance. So if you're not working, it also has like financial implications on you.
Sure.
And they want you to go back to work, but for him it just wasn't possible. With the opioids, he wasn't able to concentrate and work. And then for him, I think that the biggest change was that he was a family father. He had a good job, and he felt always guilty kind of going to the dealer, he had to go into the back alley to purchase cannabis. So the whole criminalization was for him very, very nerve-wracking. And also he was always afraid, if the insurance finds out that he consumes illegal substances, that they could take his pension away, basically.
Wow.
So that also was kind of big fear of his, because he knew it helped him, but the way to get it was very difficult. And the other thing is that once he bought it from the dealer, he said it was always kind of a black box, or he put it in quite nice words. He said it was kind of eating pralines but without reading the bottom of the box. So sometimes, you know, you have a praline, maybe you like it, chocolate, maybe sometimes you get it and it's bitter, or you don't like it. And for him, he had quite a good kind of feeling about his body and the consciousness, went also through a lot of rehabilitation, and he could clearly say, okay, some strains were helping a lot, especially the more relaxing ones, because he also had a lot of spasms in his muscles, and some of them made him just too nervous, so too much energy, and because he couldn't move so well, this created then also some kind of feeling of unwell. Sometimes he said even paranoia when he went to the black market, because there was just too much tension, too much energy. He wanted to move, but he couldn't. And that created some anxiety. I mean, and he said, you know, it was very bad for him when he got a nice strain. He used it all up. Every time he went to purchase, he was nervous. Oh, hopefully it's going to be the right one this time. Hopefully it's not going to be bad or also laced. And with the medical prescription, it was the first time that he actually knew what he was getting. So that was a big change for him, because he educated himself a lot, read a lot of stuff about cannabis, and he even knew which terpenes he wanted to have in a strain. And with going to the pharmacy, it was the first time that he could actually choose something, try out different products, try out different chemovars, and then once he found the right one, repurchase the same. And that was the first big change, which for him so made him cry, to be able to go to the pharmacy, to talk to a pharmacist, you know, to get the product that you want. And once you find the right product, then to repurchase it and really treat it as a medication that it is for him. And the other thing also, which is interesting from a scientific point of view, but also for him it was a very personal point of view that many people don't know, but pain can be, some people describe it as, can be transmission also to your relatives.
Wow.
So if you are in a lot of pain and I live with you and I see that, you can measure your brain activity of your spouse or your children, and they will have the same, or not exactly the same, but also their pain center also will be active. So it doesn't only affect the patient, but also his surroundings. And I think we know that instinctively. So some people like to watch videos of people getting hurt because it makes your brain tingle. If you see somebody, I mean, Jackass made a whole career out of this. If it wouldn't affect you to see somebody getting hurt, they wouldn't be millionaires now. But if it's over a long time period and very excruciating pain, that can even be painful then for the relatives. So for him, that was also the first time that he could really manage his pain. He now even started working again, so he can work not 100% but 30%, which also helps a lot of kind of feeling more needed in the society again, because before that he was, I think, 5 or 6 years not working, just at home getting money from the government or the insurance basically, which he didn't like, but it was just the only way for him to survive. And I think we know that, I think pain and THC is one of the most well-researched indications. We know that the THC modulates the receptors in your brain, and some people say it's not a traditional like painkiller like opioids, but it also helps yourself to distance yourself from the pain. So and that's also how he described it. It's not that the pain is completely away, but it's not like present in front of me all the time. It's more, he described it, before the pain was kind of always like a heads up display, and whatever he was doing, he had the pain in front of him. And now he had it more like in the back of his head. He knew it was there, but it didn't disturb him. He could do it, he could work, he could talk to people without the pain getting in the way. And that's also the model that scientists now suspect with cannabis, how it works, that it really modulates the brain. And the hope is also over longer time that these kind of trampled down grass roots that you have in your brain, once you have a long enough period without the pain, that the grass kind of can grow back and you don't see these traces in the head anymore. Yeah.
Wow, that's really incredible. What a story.
Yeah.
And this idea that the person can kind of get their life back, I think it's interesting if we think about it from a kind of data and AI perspective, to say, okay, on a scale of 1 to 10, where would you say his pain was before, and then where was it after? I'm curious.
So before, he said he was always like between a 9 and 10, so really at the maximum.
Disabling.
Disabling pain. Yeah. And afterwards he could reduce it to like 2 or 3.
Right.
2 or 3. So bad days was more on a 3 side, and good days a 2 side. And he said once it goes like below 5 for him, for us 5 would be already quite high, but he said once it's below 5, so if it's like 5, 4, 3, 2, he didn't like it was not present for him. If he like sit down and like close his eyes, then he could feel it. But if he was able also to do something, watch a movie, distract himself, then it was not present. So he said it's even a 0, because I don't realize it's not there, only if I concentrate on it. And I think that just shows also that I think it's still a lot of learn. So for amputations especially, have you ever heard about the mirror therapy that you can do?
I have heard a little bit about it, but tell me. Yeah.
So they use it mainly people with like amputated hands, but it's also possible with the feet. And we still don't fully understand how it works. So the way the experiment works, let's say you have cut off your right hand and you have phantom pain in your right hand. What you do is you put a mirror in between your right and your left hand, and you kind of look into the mirror in a way that it looks like your left hand is your right hand. So they really position yourself that you can sit normally and you see that you have both hands again. And then you think that you move your right hand, but you actually move your left hand, but you look at your own body in the mirror, and for you it looks like you're moving your right hand even if you're moving your left hand. And just by doing that and kind of giving the brain the signal, hey, the hand is there, it's intact, it looks good, it can move, it can reduce the pain.
Wow.
And not so many centers have this possibility, but if you have the possibility to go there, you can do it also with your hand intact. Just put it there, put your left hand there, move it. It's really strange, because after like 15-30 minutes it feels really like your right hand is moving. And I think in pain regulation, the way we do it nowadays, it's just very primitive. And I think also the economical incentives are quite high. It's still opioids are still one of the top sales for all pharmaceutical companies. But it's just the quickest route. It's kind of killing the mosquito with a hammer. It works, but the long-term effects can be quite devastating. And they have done studies, I think in the US about this, that you can reduce 60% of opioid use in a general population if you have access to legal medical cannabis, which is a lot.
Yeah, because I've heard, I don't know over what time period, but I've heard 20% of the population experiences chronic pain.
Yes.
So far and away the largest kind of indication. And it's disabling above, let's say, a 5, right? It's always going to be subjective. But I was having a chat last week with someone who was using our AI, and had experienced shingles, so neuropathic pain, at a 6.5, something like that, and was able to get down to a 4, and it was that same kind of threshold, because he was saying, above 5 in his case, this 6, he couldn't do anything.
Yeah, it was just too present.
Too present. Yeah. But then he was describing it in kind of a similar way. He was like, it's still there, but it's not dominating my life.
Yeah.
Like I can run errands, I can operate, and that was through using, in his case, he was using a vape, and yeah, it was very kind of inspiring and very fulfilling for me, to hear that story, and to know this change really opens up a whole life that was closed down and so restricted before.
I think we still need a lot of data around pain, because we only start really to understand it, as I've explained with this mirror experiment, but also something that we know that the perception of pain is different between male and female, for example.
Yep.
But if you go and pick up a medication now and read the instructions, it doesn't say, okay, if you're male, you have to take 50 milligrams. If you're female, you have to take 40. It's always like the same.
Right.
They're treated the same. So there's gender differences between pain. There's also an age difference between pain. There can be cultural differences in pain. My grandfather is from Italy, and when he was sick, he would always say, everything hurts, it's very bad, I'm going to die. So also there, it can be very challenging for a doctor, and many patients experience that. If you go to a doctor and say, I have pain, describe how bad it is. This 1 to 10 can be a way, but most of the people hopefully have never experienced a 10 and cannot imagine what it is. And I always had to laugh when I was working in the ER, and you went into the patient room and you ask, okay, how bad is the pain? And the patient was sitting there with his phone like, oh, it's an 11, and then you say, okay, if it's an 11, you cannot sit here and talk to me. So it's very hard. And if we find ways through big data also to measure pain better, there are different ideas how you can do that with questionnaires that are more precise than 1 to 10, and also to capture kind of the difference between culture, between gender. Then you can get into more targeted approach. So I think there's still a huge potential there for optimization, and the way that this WHO pyramid with these 3 steps, I think should be revised over time. It's always easy said than done, because these guidelines exist for decades often, and also different interests of different groups. So there can be doctors' groups of interest. So every country has different regulations. For example, who is allowed to prescribe opioids. These groups have interests. You have the pharmaceutical industry have its interest, but you also have the insurance who have the interest, or society. And of course, in my opinion, the patient's interests should always be in the center. And many people feel that they are not being taken seriously when they go to a doctor and say that they have pain, because it's also very difficult. And it's getting even more difficult if you say, I have pain. The doctor says, okay, here's your painkiller. And you say, but I don't want to take medication, which happens often.
Yeah.
And I think if it's possible to manage it, first of all, to find the cause of the pain, to treat the cause and not the symptom is always the best. And then try it also with plant-based medicine, who often have less side effects, is a very good possibility.
And in the case of this person with the amputation, would this then be a lifelong, would medical cannabis in this case be something that he's using for the rest of his life? And how would that be handled?
That we still have to see. It's possible if the grass kind of grows back and the phantom pain goes away, that he can stop with the cannabis over time. sometimes if the pain has been there for decades, the damage is kind of done in the brain and it doesn't go away, and then it would be more for a longer time. One thing is also maybe with the dose, that he can decrease the dosage over time, or then change the way of administration. So he started with vaporizing it also, which for him also was a huge difference from smoking. So he used a vaporizer, which helped also his lungs. He now wants to change. He replaced some of the smoking with edibles, so he doesn't have to smoke all day long. He takes an edible in the morning, for lunch, and in the evening, and smoking only when he has kind of these peaks in the pain, where he needs a like fast acting medication. And maybe over time he doesn't have to vaporize or inhale it anymore, and can go just for the edibles. And he's now also experiencing with formula magistralis cream. So he made a cream with cannabinoids, but also capsaicin. I don't know if you know that.
Yeah,
it's
the
kind
pepper,
of a pepper,
right? Yeah.
Which is also known, if you use it topically, which is also plant derived. If you use it topically, it can also help with chronic pain. It hurts when you put it on at first, but then it can decrease the pain over time. And he uses now on his stump this specific cream, and maybe in the future it will be just the cream, or cream and edibles, which would also be totally fine for him. Yeah.
And this analogy of kind of walking in the grass, wearing down, and then what it takes to grow back, it leads me to another kind of question, which is early intervention the key here? It sounds like
yes. I think that's where a lot of patients make a mistake, that if they feel pain, that they say, okay, it's bearable, let's see what's happening. And especially patients who are like averse to medications, they say, oh, I don't want to take anything, it's okay. So, and then the pain kind of increases over time, and once it surpasses a certain threshold, you need way more medication to bring it down. So let's say if the pain starts here to increase, and you take a medication early enough, sometimes it can be also paracetamol, it's okay, you can bring it down, and then kind of the body finds a way also to decrease the inflammation and to keep the pain down. If you wait, maybe you need ibuprofen, a paracetamol, and Minalgin to bring it down. So in the end, if you wait too long, often you have to take more pills than if you intervene early. And I think it's also important to intervene early enough with strong enough medication, because then maybe you have to take it only for 2 or 3 days, rather than taking weak medication for 7, 8, 9, 10 days, weeks, and then only start with the strong, because then it's already too late. Then you take like weak opioids for 7, 8, 9, 10 months, and then okay, now we escalate to the last step, but you already have been taking pills for months, rather than 2 or 3 days heavy intervention, and that the pain doesn't have the chance kind of to go into this virtuous cycle where it's kind of self-sustaining itself. So early intervention with strong enough medication, and then also stop early enough, I think is also important. Not just take medication because somebody told you to. If you don't feel the pain, start to reduce the painkillers also, with guidance, of course, of your doctor. But some people say, okay, I got this prescribed. Maybe in the ER is a classic. You go to the ER, you have an accident, and then they don't go and follow up with the GP. They just continue taking medication. Oh, the hospital prescribed it to me. So do a follow-up close enough, maybe after a week, discuss if it's possible to reduce the medication. I think that's very, very important.
Okay, I've got some follow-up questions, but we'll take a brief break, and we'll be back in a minute. Okay, we're back. We're talking about pain. We're hearing patient stories around plant medicine. And yeah, it's interesting to me, this idea, because I think I'm one of the people who says, well, I'm just going to deal with it. And, it has me thinking that that early intervention, it's a really fresh idea to me, that actually things get much worse if you don't, and you can create these loops. And it sounds like we're really experiencing some pretty major changes in our understanding of pain, because from what I've read, and I'd love to confirm this with you, that pain wasn't taken that seriously for a long time by the medical community. And it sounds like the evolving understanding is this can become a problem that can last for a long time. So doing something early that's effective is really, really key for this. And then finishing that process and moving on.
And I think we're only in the beginning of understanding pain. In some countries, like in Switzerland, we have even now a specialization in like medicine to say I'm a pain doctor. Mm-hmm. And if you talk to a specialist, he will go even more deeper, that you have kind of different types of pain. So you can have inflammatory pain, everything that's around inflammation. You can have a traumatic pain if you really like cut or break something. You can have like autoimmune pain, you can have chronic pain. So, and each pain should be treated differently. But if you go oftentimes to a GP or not a specialist, pain is pain, you know. They won't differentiate between different types of pain. And I think there are many things now that we start to discover that have been kind of taboo for a long time, stuff like ketamine infusions. Mm-hmm. Or also here in Zurich we have one pain specialist who does even psilocybin treatment, which is also a plant medicine for cluster headache. And I think we start to understand it better, we start to treat it in the right way, but then again I think we need help. Once you have a classification with like 10, 20 different pains in different genders, in different cultures, to really have the right tools also to identify these and to describe this. And I think that's with the help of technology going to be even better. Also modern imaging like MRT scans, functional MRI, where you can see the pain in the brain, if it's there basically or not. It's still experimental, these kind of diagnostics for phantom pain, but it's going to be very, very interesting also.
You know, that leads me to another question, which is how important is it? I think this is kind of like a two-part question. So how important is it that, like for me as a person, as someone who has a body, that I can really identify very specifically what the issue is? How important is that skill? Because it sounds very important from our conversation. And then, if that is important, how can I develop that? That kind of understanding? Because I think a lot of people, and I would put myself, like, I would say I couldn't really describe these things as well and that well, and maybe I don't, I can't be really precise at this moment. And it sounds like the more precise that I could be, the better the treatment could be. So what does that journey look like?
It's a general issue in today's modern society and civilization that we don't talk about feelings, and pain for many people is a feeling. Mm-hmm. You know, how do you feel? I'm in pain. It's kind of a taboo. Some would say, oh, it's a weakness, you know, if you talk about that. And I think we kind of also lost the connection between our own body to listen to it, to really feel it, because we're just so busy all the time and working and hustling and doing what we can do to survive in this world. I think the easiest way is kind of consciously. It doesn't have to be 2 hours, but from time to time, just lay down 5 minutes and kind of try to listen. Listen and feel what your body is telling you. Because if you're busy, if you're doing something, as a patient also described, you forget about what you're feeling, you know. And there are nowadays also very cool guided like breathing exercises that you can do, or guided meditations that you can listen to with your headphones on, and it will help you. Simple stuff, and some people will laugh about it, but there's exercise like try to breathe in your feet when you're lying down, and in the beginning you will feel stupid, but over time you start to realize that you can feel that better. And I think something also very simple that can help is that you can create a list of adjectives. You could even use ChatGPT nowadays for that. Give me a list of adjectives to better describe my pain. Because oftentimes when you are at the doctor, you don't have enough time and you're nervous, you don't find the words. But if you have a list, is it sharp pain, hot pain, is it feeling numb? If you have these adjectives in front of you, it can help you really then also to pick the right ones. And I try to when I do house visits, kind of carry also sometimes even a list of adjectives to be able to show to patients. Okay, pick the ones that describe it the best, because people lost also the ability kind of to verbalize how they feel. But if you see an example, yes, it's burning, and or it's sharp, or then it can be easier for you to describe it.
I think I've felt in a way a kind of hesitance to do that because I felt like if I really it's kind of focusing on it, right?
Yeah.
And I feel like if I focus on it a lot, that'll bring it front of mind, and it'll be like all I can think about. I wonder if it's a kind of defense mechanism to be kind of not really be able to read it, so that it's sounding like that's the completely opposite of what I should be doing.
I think you shouldn't do it like all day long, it can also go into the other direction. People who, we all know these people who like complain all the time and say, oh, I feel this and I feel this and this hurts and this hurts, because then you're getting into this walking on the grass again. But for them it would be better than to do exercises kind of how can you forget that and put it in the back of your head. And there's exactly these differences between individuals, between genders, because men normally tend to they did a lot of experience that women, if you measure it, they stop experience earlier when they experience pain. And the question is always, are they more pain sensible, or are they just more sensible beings to say, hey, stop, it hurts, because men, they kind of want to push through. And if you take out this equation, a lot of scientists say women feel less pain than men. But they're more open to kind of name it and do something about it. That's also even one reason why women live longer, because they go and seek a doctor earlier. And even married men live longer because they have wives who take them to the doctor if they see that he's in pain, if they know them. And I think so, to develop this ability to find a good way to connect with your body is crucial. But it's a long journey, because oftentimes we learn to forget about everything and push it down and don't think about it.
And I'm thinking about that as kind of a general, something that generalizes this idea that if you're confident that there's a solution, it makes a lot of sense to like focus on a problem, right? Because that's part of like making sure the solution will work. And I think I think from my own experience, I feel like, well, if I just have to live through this and just bear it and just keep going, maybe I don't want to focus on it because there's nothing I can do. But as we talk about these interventions that can be really effective, and going back to the person dealing with the amputation, it was too present, right? So now being able to go into some detail and say, okay, I've tried this particular genetic, or I've tried this way of, vaporizing versus, then it's around kind of, the more you understand the problem, the better you can navigate towards a solution. And it's a really kind of fascinating approach. And I think you're kind of changing in our conversation, my relationship with my body, to say, okay, let's listen, solve it. And if you're experiencing some kind of extreme pain that can go on for a while, like happened for me about a month ago, I fell off my bicycle and landed wrong on my foot, and had a lot of pain in the big toe. There was kind of nothing I could do about it, so I was just kind of ignoring it. it healed and it's fine. But had I had the idea of, okay, focus on it, what is it? It's sort of this dull pain, that's also information, right? If it's a sharp pain, that's a different story. And knowing that I can feel it, focus, solve, I think, I think leads to a totally different experience
I mean, it can happen that you have a problem that is with nowadays technology even not solvable, and then it's more about learning these coping mechanisms.
Yeah.
But still, I think because our technological advances are so quickly now, is from time to time reconsider and reinform yourself, are there new options available? I think it's also something that you should do. And there are other disease areas like rheumatology, which is often an autoimmune disease. And I went to a talk because there are diseases like fibromyalgia, which is kind of a pot of, we don't know exactly what it is, but we know the symptoms. And I talked to a rheumatologist because I had a patient who had fibromyalgia, and she also took medication for it. And I asked her, do you see a rheumatologist from time to time? And she said, no, because now I know it's fibromyalgia. They cannot do anything about it. This is my treatment that I have to do. And was quite interesting because he said, yes, he was an older gentleman. For the past 20 years, that was the case. Now he recommends to go at least once a year to go to the rheumatologist, because with new diagnostic tools, he said sometimes even after 5 or 6 years, they find out, it's actually a genetic mutation in something. Or, we have now a new tool where we can more precisely tell you what is actually the cause. It's not just fibromyalgia, but it was maybe a masked gout that was atypical, or they find new treatments. So he now says once a year at least go back to see what's up in today's medical environment. And with new technology, it makes totally sense that before the development was so slow that it said it takes 10 years to develop something new. Now it's sometimes even 10 weeks, until we find new tools. And so to revisit it and to see what's up, I think that's important if you have the possibility to do that. And
super. So Nico and I are talking about pain. We're talking about how plant medicine can help with pain. And I think just kind of one last question on this, and then we'll conclude here. There's so many different types of pain that we talked about, and so many different plant medicine solutions. I think I'm just thinking about how important experimentation is in that process, right? So figuring out exactly what the issue is, and then running these various experiments. So thinking about the person with the amputation, some plant medicines made the person really edgy and anxious, and others. And tell me a little bit about that experimentation process and how someone should do that or approach that.
Yeah, I think it's quite similar that even with mainstream medicine like opioids or all the NSRIs, there's not a guideline that you can say, okay, step 1, take this. If that doesn't work, step 2, take this. Often it's kind of the experience of the doctor, but also your own experience. It's still, until today, was kind of a trial and error. You tried something out, did it work, yes or no? I think with plant medicine, it's even a little bit more complicated because let's say you have a cannabis strain with 20% THC. It can have totally different effects depending on minor cannabinoids and the terpenes. And often you don't have this information. So I think the first step is also to request information from the pharmacy or to research it. And there are nowadays apps and tools where you can see kind of what is the expected chemovar of a cannabis genetic. And the second step, I think, is also very consciously make yourself kind of a diary, either with the help of a tool that you can use, or at least write it down. Okay, what intervention did I do, at what time, did I vape it, smoke it, what temperature, kind of collect this data and then learn from it. And I think with the app, that's going to be way more easy, because before you just had the possibility to do your own diary and compare you to yourself in today and in the past. But I think with AI and the ability to treat large data sets, then we suddenly can say, okay, we compare not just to yourself, but to other 30-year-old males, Hispanic, white, doesn't matter, from this area with a numb pain in his left shoulder because of an accident, because he broke his collarbone. That's going to be very, very different than just, okay, I have a pain of 7.
Yeah.
As it was today, until today,
Yeah.
And I think then what's also important is to not to mix too much. So I think a lot of people say, okay, let me just try 10 different strains. They smoke some, they vaporize some, they eat some, they make a cream, they make their cannabis butter, and like very unorganized. So I say, choose one strain, choose one consumption method, and then stick with it for at least 7 days, better 14 days. Make your experience. Is it okay? Is it not okay? If it's not okay, try another one and compare. What was better? What was worse? But also give yourself some time and not do too much mixing too quickly. And once you found the right one, I think it's important to know that even if the name is the same, it can change over time.
Yeah.
So we know that from growing, its plants are plants, and the chemovar can, if it's not exactly the same way that they grow it, the changes in the terpenes, in the cannabinoids can be quite huge. And that's probably still a challenge for the future, for the growers and also for the pharmacies to provide the information.
The information, yeah, and definitely with Ravana, that's the vision, is to, as much as possible, help people in a way kind of limit the experimentation process, because it takes a long time, it's expensive, and so really zeroing in and saying, for me, what is the right plant medicine that's going to bring the state change that I'm looking for. And you're right, historically that just wasn't there. You didn't have the information, it was too expensive to process, the algorithms weren't there to really make it useful and present. And then also, a lot of people don't write a diary, so there needs to be a kind of like interface that works with that. And those are all things that we're working on in order that people can really kind of set, this is where I'd like to be, and go there. And in a way, you're kind of making an agreement with yourself that you're going to be like dissatisfied until you get there. And I think maybe that's part of the reason that people just numb themselves and say, well, I'm not going to pay attention. But now the paying attention really pays off, because
and the providing also the providing of information. It's the same if you went to a doctor 100 years ago and you just sat there and said ow and pointed on your knee, the doctor couldn't help you very much. And also tools like Ravana, they need to have some information. The more information you can provide, the more precise information you can provide, and you can learn that over time, the better also the algorithm is personalized for you. And I think that's also something, hopefully it's easier also to provide information to a passive kind of an algorithm rather than to medical professional, even if I'm a medical professional myself. But I have to admit, the time is limited that you spend with your doctor, often also by insurances to 20 minutes, 30 minutes, 40 minutes, and it's just so much that you can tell in this time. And it's of course totally different if you give feedback over 7 days, more or less 24 hours, how you feel. That's the difference between just a short intervention like this long-term diary, that you can give way more input, and it's going to be more precise.
Yeah. And there's something, I don't know what happens, but I find that when I visit a doctor in the office and I get the questions, it's so hard for me to remember.
Yes.
Right? It's so hard to recall.
Yes.
But if it's something that is just happening in your life and it's an easy way to record it, then, it's kind of, available to be acted on immediately, and I think more accurate, because really it's the weirdest thing, that blank. Do you find that happens with other patients?
Also myself. I mean, you can think to yourself, if I ask you now, how many times did you have pain in the last month?
Gosh, I
10, 15, 20, and how many times was it above an 8, and how many times was it between 2 and 3?
Yeah.
You had no idea. But if you would carry kind of a meter with you, and every time you had pain, you had to kind of just to push one button, 8.
Mm-hmm.
Now it's an 8, now it's a 3, now it's a 2.
Yeah.
Then you can do it passively. It's just one click, okay, and then you have the statistic. That's totally different. And nobody remembers. I mean, a lot of people don't even know what they had for dinner 2 days ago,
Sure.
And how would you remember how many times between a certain area?
Yeah.
It's very hard. But if you do it in the moment, you don't have to think too much. You just push a button, then it's being recorded, and then you have this kind of a statistics. And I think that is the same with blood pressure. I mean, if I ask you, okay, have you ever measured your blood pressure? Yes, probably.
Mm-hmm.
How high was it?
Don't know.
I don't know.
Yeah.
There are nowadays tools that you can carry on your wrist, and they measure 24/7. And that's another database then for the doctor or an algorithm to use and work with.
Yeah.
And just to say, I think 8 months ago in the pharmacy they took my blood. I think it was something 120 or so. So that I think is also human. Nobody knows everything. Of course, some people, they are very, very, they know the whole medical history. And I mean, I had my shoulder operated twice. That I know. If you ask me what year, I couldn't say.
Right.
From the top, I would have to go back. Okay, I was in the army in 2008, so maybe 2009 was the second one. The first one was 2. So you have to kind of start to reconstruct. But if you have this all recorded, basically, then it's way easier.
Yeah, I'm thinking about when I started using my Apple Watch. I thought, if you would have asked me, I would have told you honestly that I worked out 5 times a week, because that's what I thought, and that's what my intention was. And then with the Apple Watch, I realized it was twice a week.
Yeah.
But I wasn't making it up. That's genuinely 5 times a week I intended to work out, and then I would have a phone call or something would interrupt it. But in my head, I had done it. So having that too, I was like, okay, I need to increase that. So I knew.
Another example is sleep. How many hours did you sleep?
Yep, exactly.
If you ask them, everybody's going to say, 6-7 hours or so. But if you actually track it, it can be a totally different story.
Yep.
Yeah.
Okay, so that concludes our conversation on pain. Thank you very much for listening. We'd love to see your comments, or for you to call in and leave us a voice note, and we can discuss in more detail and keep it going. So thank you for listening.